Good evening, everybody. I'd like to know how many people in this room are paying 10% or more for their health insurance and their health care. 10% or more of their income for their health care. Number of people. Anybody paying more than 20% of their income for health care? How many people don't have health insurance? Number of people don't even have health insurance. And that's a terrible thing. First of all, I want to make sure to thank, and we should all thank, Congressman Ellison for introducing an important bill of health care reform, and that's on Medicare payment reform. That bill will, instead of us paying for just more procedures, we'll pay for healthy outcomes. So that's what we should pay for, not just folks getting more procedures all the time, but doing evidence-based care and getting paid for healthy outcomes. It's one of the ways we're going to save money in the system to pay for health reform, and Congressman Ellison's way ahead of the curve on that. We should thank him for doing that. The health care debate's heating up on Capitol Hill. We all know that. President Obama and Congressman Ellison want real change because people like us are demanding more accessible, better quality health care that we can all afford. That threatens big insurance companies and the pharmaceutical industry. They're going to outspend us on this campaign like they did in '94. But we're more powerful if we speak with one voice, as Keith said earlier, and fight together for health care we all deserve. Politicians have been talking and admiring this problem for a long time, but this time we believe it's different. We have urgency because we can't fix the economy unless we fix health care. We also have a popular president who's determined to pass real reform in the next 12 weeks, ladies and gentlemen, in the next 12 weeks. So now is our opportunity to help President Obama shape that reform. My union, AFSCME, believes that everyone in the United States should have accessible, quality care they can afford. We're fighting for a uniquely American solution that gives you a guarantee of coverage and real choice. Keep your private insurance if you like it, or join a new public plan so you're no longer at the mercy of the for-profit insurance industry. No matter which you choose, you are guaranteed comprehensive benefits that meet your needs, and you'll pay for insurance based on your income. Government will advocate for you, setting and enforcing rules so that private insurance companies will have to put your health before their profits. Reform also means eliminating the enormous inequities in our broken healthcare system for people of color. I'd like to focus on affordability. Average family health care premiums in Minnesota have increased 90% since 2000. Healthcare costs are skyrocketing 13% each year. Nearly 1 million Minnesotans spend more than 10% of their income on health care, and a staggering 240,000, nearly 250,000 Minnesotans spend more than 25% of their income on health care. That's too much, ladies and gentlemen. No one, in our opinion, should have to spend more than 5% of their household income on health care costs. And we define affordable housing, for instance, as shelter that costs no more than 25 or 30% of a person's income. So 5% should be a reasonable amount for health care. It's no secret that rising health care costs are driving many families to financial ruin. Half of all home foreclosures are due in part to high medical bills, and unpaid medical bills are the leading cause of personal bankruptcy. So what does quality, affordable coverage mean? It's coverage you can afford. Coverage that's affordable for every person, family, and business. Coverage with premiums and out-of-pocket costs based on your ability to pay. Government acts as an advocate, sets and enforces rules, so insurance companies can't deny coverage or raise rates based on health history, age, or gender. It's comprehensive benefits you can count on. Comprehensive benefits that meet your needs for preventative care and chronic care. Low out-of-pocket costs so you can afford to get medical care when you need it. Choice of docs and hospitals. It's a choice of a public or a private plan. You keep your current insurance plan or join the new public plan. The choice of a new public plan is a guaranteed backup that will always be there, even if you lose your job. And it's equal access to quality care, equity in health care treatment, equity in research, and resources to people and communities of color, stronger health services in low-income communities. And finally, to drive down costs, we need a public option. We can't move off that. We have to have a public option that's not controlled by the insurance companies. The public plan would be managed by the federal government, would pay hospitals and doctors to take care of patients. We've already got a proven public plan with Medicare, which serves American seniors and persons with disabilities. Unlike private plans that pay high executive salaries and maximize shareholder profits, a public plan exists to pay for people's health care needs. Private charge fees for services you don't need that don't improve your health. A public plan would be dedicated to healthy outcomes, not profits. And ladies and gentlemen, 73% of Americans support the choice to have a choice of a public plan.